Well, good morning. This is Dr. Bill Williams on the Influencers Podcast, coming live from Atlanta, Georgia. And today we are so proud to have Dr. Anna Esparham from Missouri, I believe it is. Missouri. Integrative physician and pain coach helping women with fibromyalgia. It's her specialty. She's got board certification in several areas, and I heard she's going for a third. So I'm going to bring on one of our good buddies, Dr. Anna. Hello, Anna.
Hey, thanks for having me, Dr. Bill.
Wonderful to have you here. And you're a busy woman. You do it all. And I'm going to really get started with the big question of where were you, what happened, and what surrounded you to give you this inspiration to do what you're doing today?
Well, it was through my own experience with health issues as a conventional medicine doctor that I just couldn't find the help that I needed to improve my quality of life. So I went and just researched and figured it out on my own how to heal. And that's how I want to share the good news with all these other women dealing with chronic pain and other types of syndromes like fibromyalgia, so they can truly empower themselves to heal and learn the right modalities to heal.
So you dug in quickly, and you must have had some impetus, some great failure story that just led you to go from the traditional practice of medicine into functional and integrative medicine. What was that?
Well, I couldn't really help people with chronic pain. I mean, I was getting like 20% better of my patients. And so I really had to figure out what other modalities out there that would actually help patients heal from chronic pain, because I knew they could. I knew there was other things besides medication and procedures that are traditional in the conventional medical field that these patients could actually use and heal their chronic pain and fibromyalgia.
And as a physician, you see people get into these trouble spots, and their life starts to fail because of the pain, because of the illnesses that are not addressed by traditional medicine. What are the three big reasons why people fail or fall into these medical, I don't know if they're traps, but they're nondescript diseases that nobody can handle?
Yeah. And I that's why I just think, number one, you can't get a lot of the emotional, spiritual needs, which is one of the biggest aspects of healing from chronic pain in the conventional medical system. And that is actually one of the biggest cures out there for chronic pain, is through emotional processing therapy, finding prayer, spirituality, using mind-body therapies other than just taking a pill every single day or getting a shot. And then number two is really that belief system where they shift their mindset from maybe a medical doctor tells them, yeah, you're just going to have to accept this and live with this forever. And so then they believe that they will have to have this chronic pain forever. And so it's shifting that belief to like, hey, I can actually heal myself and I can get rid of this. I don't have to live with this forever. So that's another big aspect. And then three is self-care. It's really hard to take care of ourselves, eat well, sleep well, get enough exercise, and have healthy relationships and not toxic ones, and set boundaries for ourselves. So that's the third biggest key to healing chronic pain.
Well, I dealt with chronic pain as a therapist, as a dentist myself, head and neck pain. And so I really do see that if you don't take the unconventional approach, then you probably will be less effective than you could be. So I totally agree and identify with what you're saying. Let's go through the lightning round and find out what motivates you internally to walk that different path from most medical practices.
Well, I find that a lot of times I'm seeing people with chronic health issues, and I've dealt with my own chronic health issues, both chronic pain and autoimmune disease. And so I want to help people suffering from that just as much as I needed that help.
What is your practice motto?
Health is power, and it's all about awakening your power within.
And do you have like success secrets that you can help people to model that will set them free of these pains?
One is consistent small habits every single day. Two is shifting from a static mindset to a growth mindset, which is more positive. And then three is definitely hiring a coach to help you every step of the way.
I couldn't agree more. You can't walk this path alone, particularly when it's so new. People in chronic pain, they don't have anything to compare to. Why would somebody choose you as their physician?
Well, one of the biggest things is I've been through the chronic pain and a lot of chronic health issues, and I've actually walked that experience and been through it all myself, and can definitely help you implement it in your lives. So I think that's one of the biggest pieces in finding a coach is doing it yourself.
Who's your ideal patient?
Definitely someone who is motivated to implement a lot of those self-care strategies and mind-body therapies and do the work that it takes to heal from chronic pain.
Is there a way to find these people, your ideal client?
Usually a lot of them are out on the internet trying to figure out, how do I treat my chronic pain? How do I treat my fibromyalgia? And so that's why I have my podcast, Health is Power, to really inform and educate a lot of the women looking to heal their chronic pain.
So you have products and services you offer. What would those be?
One of them is my coaching services. So I have several group coaching programs for headache pain and chronic pain, as well as autoimmune disease. And then I also have a sleep program, because sleep and pain are so associated, that I actually just focus on sleep so that they can actually help their pain a whole lot more.
So it sounds like you have a menu and you have options for people with different issues. So how do you come up against the competition in medicine, the allopathic medicine, as we call it?
Well, I actually use a lot of evidence. There's so much research out there that they actually are not informed on. And so I just explain the evidence, and then they're like, "Oh, wow, I didn't recognize that. I didn't realize, I didn't go out and search for that." And so I just kind of, put it on the plate for them.
If you go to a fibromyalgia help group online and you offer to give them some solutions, do you find that you mainly get objections from those people because they don't want to change? Or how do you feel about those kinds of folks?
Yes, it is tough, because sometimes people living with chronic pain or other chronic health issues, sometimes it serves a purpose and they're not quite ready to make that change, because sometimes they have lived through a trauma and that's been really difficult to process. And a lot of times pain doesn't change unless you process the emotions, the healing, the trauma. And so you kind of have to wait. You have to wait till they're ready.
Yeah. Do you ever get an angry client that just doesn't really see eye to eye with what you're recommending?
Sometimes when you explain about the mind body therapies for chronic pain, they think it's all in their head, and that's not true. Chronic pain is actually very physically real, but the emotional pathways are along the same pathways as the pain pathways. So you can't take care of one without taking care of the other.
Yeah, very true. What about a five-star client experience? When you actually can give somebody relief, how do you go about creating this experience of success?
I go above and beyond. I try and give them a well-rounded experience, every aspect of lifestyle, self-care, healing modalities for them, so that they can tap into what really works for them, and then really meet them where they're at and have a lot of grace for however long it takes them to heal.
Yeah, I like that. I like the fact that you give a person a five-star experience, and then they will in turn become your brand ambassador. Is that kind of your focus, is to create happy, raving fans?
Yeah, I think it's really important to get testimonials as part of like your backup for your credentials, because you really want to know, wow, did she actually help other people? And so it really helps for people to kind of explain their experience with my program.
And tell us what you're grateful for today.
My family, my husband, a loving, supportive family. It's just amazing. They keep me sane.
Am I right that you're actually from Missouri?
Yeah, yep. Kirksville, Missouri, a nice little rural town.
And is that snow out there behind you?
Yep, yep. It's 6 degrees out.
Oh my gosh. Winter has come and never left. Tell me about how you start every day.
Well, I do pray to God, and I just ask Him for a healthy, productive day that I can stay energized. And I drink coffee, read the Bible, and sit with my husband and my puppies.
How about your goals now? Have you got a plan to achieve your next goal?
Yes, my next goal is becoming quadruple board certified in osteopathic neuromusculoskeletal medicine. So I'm going back to residency and hopefully going to pass my board exams afterward.
Wonderful. Well, I love the osteopathic profession. They birthed both of my children, and we
Oh,
had them work
wow.
with a osteopathic physician with the Vail of Fryman technique. So I'm well aware of where you're headed.
That's it. That's who, yeah, I'm going to learn about that.
So, what happens if you don't get this next thing accomplished? Is it going to be even a possibility you won't make it, or are you already convinced that you will get this third board certification?
I am pretty convinced that I'll get this board certification because I know my weaknesses and I'm aware of them, and I generally will work on and problem solve and figure out where I need to find the help to succeed.
If you have to overcome a challenge, how do you go about doing that?
Well, I ask for support from my network, so from my family and my friends, and I have my own life and business coach to help me when it's dire need.
Yeah, that's an important point you brought up. Coaches need coaches. You know, you can't do it even at the highest levels of coaching. You need a coach beyond yourself. It's a great idea. Once you have a revenue generating idea, how do you convince your significant other to loosen the purse strings, maybe?
I think the biggest thing is just making sure that we're both going to have enough quality time together and it doesn't interfere with our marriage. And then also making sure it's not too much of a big risk where it undermines our necessities and our needs.
In your business, have you had a possibility of using paid digital media like Facebook and Google and LinkedIn ads to help you grow your business?
Yeah, Facebook ads to actually put myself out there so people know that I exist, because they really don't know that there is an integrative pain doc that exists, or that's also a pain coach and has these types of programs.
And what is your experience on the percentage of revenue you recommend people in your profession use to invest in paid digital media? Any concept of recommendation there?
Right now, as I am just beginning to build slowly after about a couple years, right now it is about, I'd say, 30% of my revenue. It's a little bit higher than I want, but it definitely helps bring in clients.
Yeah, it definitely works. Look back at yourself, 20-year-old self, you know, you're just getting started. What would you recommend to that 20-year-old young lady who's starting out on their career?
Oh, don't be so involved in approval addiction and trying to gain approval and validation from other people's opinions. Trying to follow my own path. Yeah.
Pretty good advice. I think I would say that I'm just the same mindset. Tell me about your living mentor and what is their impact on you?
Well, I would say that is currently my life and business coach, Allie Daniel of Punch Drunk Soul. And she's really helped me align my business goals with my spiritual goals for myself. And she really just makes sure, holds me accountable to what I really want to do in life and kind of gets rid of the superfluous stuff that I don't need.
So why is being impactful important to you then?
Because I want to help people bring out their true gifts, and health is really a number one priority. If they don't have their health, they really can't share their true gifts and serve others. And so that's really important to me.
Excellent. Well, what about the long term when you're all said and done? You look back on your life, what do you want to be remembered for?
Yeah, this is an interesting one because it's really not something about all my achievements or awards that I've had that never really had a lot of meaning. But what has a lot of meaning for me is having grace for our humanity and just providing one another love and support.
I like it. In our influencer podcast world, we want to support you and people like you that are positive, that influence others. So how can we do that? How can we support you? Give us the links or the podcast names or your websites so people can find you.
Yeah, you can find me at healthispowher.com. So it's POWHER.com. And you can also find me at Apple, iTunes podcast, and Spotify at Health is Powher's podcast. And you can find all the links on my website at healthispowher.com, as well as Instagram at healthispowher. And I have a Facebook group if you all want to join as well, where I give you guys free resources and free videos.
And what's the name of that Facebook group?
Health is Power. Very simple.
Health is Power. So tell us about what you would say about your experience on our influencer podcast show today, Anna.
I loved it. I have such a great time with conversations with other people in this realm, especially in this business realm, when you really want to support other people who are starting out their businesses to serve others and make a bigger impact in the world. And it's just really important that we all support each other because this is all for each other's good. And it's just important to have meaningful, impactful relationships.
Excellent. Well, I'm going to give you the last word and let you address our audience that's worldwide and tell us exactly a perfect finishing comment.
You know, nothing is ever a failure, even if you try to start a business. It is all just a stepping stone for where you need to be in your life.
Thank you, Dr. Anna. It's been very exciting and to the point. You're an excellent interview, and I really do appreciate and wish you well as you go through working for the osteopathic certifications. And I know that people with pain and people with fibromyalgia will probably be seeking you out because it's rampant and it's debilitating, and there's a big need for people to treat that particular situation. So thank you again, and I appreciate you being on the Influencer Podcast.
Thanks so much, all.
You're welcome. Good night, everyone, and we will see you on the next Influencer Podcast from Atlanta, Georgia. This is Dr. Bill Williams.